the FollowMyHealth patient portal from Allscripts. Today's presenters are myself, Jessica Long, Director of Sales for Population Health, as well as Dr. Paul Bassel, who is the Clinical Coordinator of Information Technology at Baylor Health. A few things before we get started, just some housekeeping items, is that all participants are currently on mute. If you do have a question, please feel free to utilize the chat box on the right-hand side of your window. We'll be spending some time later on in the presentation to answer your questions specifically. So without any further ado, we'll go ahead and get started. I want to go through just a few items before I hand it over to Dr. Bassel, who is going to take us through the patient side of things, as well as some of the integration with GE centricity. So first up, we're going to talk a little bit about patient engagement specifically, what it is, how it can help you, and what you need to know, with the focus of how are we going to help you improve patient care, how will we achieve meaningful use and help you with both stage 2, stage 3, and beyond, and also how to realize a positive return on investment and even reduce costs. So first, let's just take a minute and touch on the different phases of patient engagement. As you can see, most of them are concurrent with the stages of meaningful use, which is no coincidence. But patients must be engaged with and feel empowered by the access that they have to their health records if we really have any chance of meeting future stages in managing population health, as you can see with stage 4 and stage 5. With that said, improving patient care is one of the most important things that you do every day. Patients using a portal have fewer quality issues and make better choices about their health. In fact, one of our clients, Brown and Toland, did a study on this with their own population, and what they found is that after about 16 months, 25% of their patients who used FollowMyHealth were up to date on preventive care, which is double the rate of their non-portal users. That can translate to a better quality of life for your patients. Secondly, you must have engaged patients that actively use the portal to achieve the meaningful use requirements that we see here. As a review, you need to have online access for more than 50% of your unique patients in the reporting period. You also need to ensure that more than 5% of those patients view, download, or transmit their protected health information and send a secure electronic message to the provider, as well as provide patient-specific education to 10% of patients, depending on their medications, problems, and results. FollowMyHealth was really designed in such a way as to make it easy for you to meet these requirements. For example, an invitation to the patient counts as granting access. Once the patient logs in to view their information without clicking any other screens, the information on the home screen is enough for us to count that as a view for view, download, and transmit. And at that point, they also have access to their patient education. So just by logging in, they've already met 3 of the 4 requirements that we see here. And then, of course, with secure messaging, all message types except appointment requests count as secure messages into your EHR. Lastly, FollowMyHealth was built with an open vendor-agnostic architecture, which enables it to integrate directly with your GE centricity EMR. This means that you can really maintain your existing workflow and have a shortened learning curve, which will help you increase efficiencies. For example, when you receive a message for a prescription renewal versus getting a phone call for that same prescription renewal, it can really reduce the amount of time that you spend caring for that particular task. Dr. Bassel is going to show a little bit more about this later, specific to some of the items that he works with on a daily basis. So now that we've talked a little bit about patient engagement and what it is and why it is important to you, let's meet FollowMyHealth. We are indeed a patient portal, meaning that we will connect to the database, pull out the information for the patient, the clinical items such as medications, allergies, conditions, etc. But we are different in the fact that we do double as a personal health record, meaning that the patient owns the information and they can use it, share it, and manage it however they need to. We are also different on the market because we can serve as a health information exchange for the patient, meaning that one patient can see multiple providers and see the data from each of those providers in one portal account. This is especially important as we look at the disparate EMRs that are on the market. A patient may actually see a provider that uses Allscripts, one that has GE, and one that has a third EMR vendor. In that case, they would typically have 3 different portals to log into, and that's just not going to happen most of the time with patients. So FollowMyHealth offers an option that connects to each of those EMRs and gives the patient an aggregated view of their entire record in one easy-to-access account. FollowMyHealth is really a stepping stone as you start to consider the idea of population health and even stage 3 and stage 4 of meaningful use. Many people think that having a portal means having patient engagement, but really the true patient engagement comes from managing populations to a better outcome by providing both doctors and patients with the right tools to do so. The truth is that these groups are in business to help patients manage their health, and a portal is just the very first step in doing this in many cases. Although it will help you meet meaningful use, we are not just a portal. We are just one piece of the puzzle that affects every area of healthcare: providers, nurses, patients, payers, etc. And that's very important to consider as we move to a fee-for-value model. So as you can see, in the future, as things change with how you're paid, how providers are chosen by their patients, and even other federal standards for meaningful use come into play, you'll be able to plug in and adapt your patient-centered platform on top of your current system to maximize your investments. All right, so with that, just a little bit of information on what patient engagement is and how that affects you. I am going to send it over to Dr. Bassel. And he is going to take us through some of the basic functions of FollowMyHealth, as well as some of the integration with GE Centricity. So Dr. Bassel, I will turn it over to you.
Hi, thank you. I am Paul Bassel. I am a pediatrician. I've been with Baylor for about 20 years, and I'm the director of the Baylor Scott and White North Texas Patient Portal Project. And speaking of organizations that use multiple EMRs, that certainly applies to our organization. Our 15 hospitals in our region of the organization are connected to Allscripts Sunrise Clinical Manager. However, the Health Texas Ambulatory Physician Unit of Baylor of some 700 physicians uses GE Centricity. And we also have an oncology EMR that's being installed as we speak, and our accountable care organization has over 70 different EMRs in use among its 2,500 providers. So our strategy of a patient portal that's useful to our common patients clearly needed a platform that was EMR-agnostic, that could bridge across all of those systems. So I'm here to tell you specifically about how FollowMyHealth connects to GE Centricity, and I'll talk you through a little bit of the modifications that we actually partnered with FollowMyHealth to sort of conceive and and make this work for us. So I want to start, I guess, with going to Centricity itself and showing you where everything happens at the clinic level. Most of what happens at the clinic, of course, is the secure messaging piece. And you're looking at EMR, Centricity EMR 9.5. This is the version that we're currently using. We'll be upgrading to 9.8 here hopefully in a few weeks. But the messaging activity takes place in the messaging tab of the desktop, which is here. And if you don't already know this, this part of Centricity is actually a web browser. It actually calls up Internet Explorer on the machine that it's running on. And so what you see here is actually a web page developed by FollowMyHealth to accomplish our messaging needs. So this is actually an open environment. It's amazingly simple, and I would say that there's plenty of room for maturation of this product. So I'm not gonna pull any wool over anybody's eyes. I think that this is a great start, and it needs to go further, but it does work. So what happens first is you need to find the inbox for the provider, and that would be me, of course. And it's set up in an open fashion so that anybody in my clinic can go and look at my messages. So my medical assistant may come in here and screen my messages. I may come and follow her and screen my messages later. So once I'm in my inbox, you can see the messages. I've recently cleared them out, so there's only 3 test messages here. And you have the utility of sorting your messages by different filters here, such as message type, so that the appointment requests can be all worked by a staff member. Medication renewals can be worked by my medical assistant, and patient messages can be worked by my medical assistant and me. So if I want to read a message, I click it, and there's a question that needs to be answered. I can just send a reply back to the patient, and it's done. And when I did that, that is actually archived in the chart. So the document will come back to the patient's chart. There it is, right there. So this has permanently become a part of the patient's chart at this point. Now, I can also send new messages to patients. So if I am in patient context in the EMR, so I'm in Abhishek's chart now, and I go back to type a new message, it will automatically address that to Abhishek, and then I can just begin the message and send it off to the patient. So if I need to follow up on something, I can do that. So this is true bidirectional messaging. If my medical assistant were to be reviewing these messages, she can send me a little flag by clicking this button, and notice now there's a little orange tag on this message. This is a signal to me that someone has already touched this message and I need to review it. This is how we get around the fact that this is just an open inbox that everybody looks at. This is how I know somebody's already touched that message. FollowMyHealth can also allow you to select documents that go from the EMR to the patient, and I'm going to show you some examples of how you can use that. One of those is what we call a lab letter, and it actually can contain any content that our clinicians put in it. For example, prep instructions for a colonoscopy can be put here and sent to the patient. Another way that we are using these documents is to convey patient instructions from a visit. So somewhere on this list, here are patient instructions from from a recent office visit that was generated in the chart. And the interface from Centricity to FollowMyHealth automatically picks up these documents and sends them out. And so I will take you to the portal. I have to log back in now. Should only take a second. So this is my account. This is actually real, but speaking of functionality that is user-friendly, you can add family members to your account. So I've got one of my kids, and I have my pet test patient as proxy accounts. So here's poor Abhishek's portal, and Abhishek has a really busy set of diagnoses and pretty extensive medication list, and that's because everybody under the sun uses his chart for testing purposes. But here is the inbox where the messages are, and you can see that the messages that I just wrote to Abhishek are nicely displayed here. If we go back to the My Health tab, you can see that there are documents there waiting to be read. And here are some of the things that were generated in the chart that went to the patient. Here's that office visit instruction document that I showed you. Here are those colonoscopy prep instructions that I had just showed you. And there's nothing fancy about it. It's all plain text, but it is logical and readable. And you can be creative and imaginative about the content that you want to convey to your patient in that manner. Now, Centricity is not exactly an EMR-friendly, a portal-friendly EMR. It does have a tethered portal that it works with, which is made by Cryptic, but the means by which information goes in and out of Centricity is cryptic, we could say. So I'll touch upon the methodology by which you can prepare Centricity to yield information out to the portal. Lab results, for example, are available, and so is anything that is present on the Centricity flow sheet. So I'll jump back to the Centricity flow sheet for just a minute at the risk of making you dizzy and show you that the setup behind this. Any materials that you want to convey to your patient will need to be assembled into a flow sheet view in Centricity. So we actually took all of the available labs and put them into a single flow sheet view. We took the immunization data and did the same thing. And by doing this, it allows you to configure Centricity in a way that it really wasn't designed to behave. And so if you have certain information such as sensitive lab results, like HIV results, for example, you would control the flow of that information to the patient simply by not including that on the FMH lab flow sheet. And that's how you set your release policies for results and for any of the other discrete data. And then the FollowMyHealth dashboard administrative tool has a separate setting on the back end that allows you to define which of the document types will be released to the portal. So you do not have to release the entire chart to the portal. You can choose which documents will be released. Health Texas / Baylor has decided to allow the lab letter document and the patient instructions documents only, but you can configure it to your specifications once you have made those decisions. So the full gamut of information is available and it's displayed very nicely. And FollowMyHealth has made great use of info button to convey educational materials on medications as well as conditions, all of which are meaningful use, certified, and give you credit where you need it for your attestation. So we continue to look forward to partnering with FollowMyHealth to continue to mature this aspect of functionality. I know that in a matter of probably a few days, they intend to deliver to us the ability to review the items that we have sent out from here. So that's been a very heavily requested feature, and I know that they're about to deliver that, so I look forward to seeing that soon. And all of the other improvements that we've been asking for, hope to see in the near future to help all of us use this better. So that's kind of it in a nutshell, and I think we can take questions from here.
Okay, I just want to remind everybody on the call that if you do have a question, please go ahead and utilize the chat box on the right-hand side to enter those in, and we will answer them as they come in. Nothing quite yet, so we'll wait just a few minutes and see if we can get any questions regarding either the integration with Centricity or anything specific to patient engagement, meaningful use that we can address for you right now.
Hi, Jessica. It looks like we've gotten a couple of questions. One is, does this work with CPS 12?
So that's a great question. We currently are looking at building an interface to CPS. The one that we have in place right now is for Centricity 9.5, which is what Dr. Bassel is using. But we are looking at being able to create that as well and be able to speak to some more specific functionality here in just probably a few weeks.
The data structure of CPS is really almost exactly the same as Centricity EMR. So all of the basic principles employed in the Centricity EMR interface can be applied to the CPS side. Those products are remarkably similar.
Okay, and we had another question. Do you have a solution for provider to provider?
We don't currently. I know, Dr. Bassel, you've talked a little bit about that, and do you want to go ahead and take that one on?
I actually did not tell you about it. I didn't show it to you. So alas, FollowMyHealth does not provide that service. I have lobbied them for that, but it's not really in the scope of their product at this time. So the solution that we currently have is this button right here. If you click this, it takes you to, well, hopefully it will take us to, yes, the Cryptic Messaging Center, which should be familiar to all of y'all who use Centricity day in, day out. Cryptic does provide provider-to-provider messaging through the MU-certified direct protocol and all of the nice ways that's supposed to be done for this year. So we would actually come to this environment to generate a provider message such as a referral and take care of that business here and then return to the FollowMyHealth messaging area via the home button. And so you have to maintain your Cryptic environment and simply disable the provider-to-patient messaging functionality and continue to use it as is for the other part.
Okay, thank you. And then we had another question. Are you sending the numerator reporting data to GE reporting?
The reporting for GE's MU attestation occurs in their CQR cloud-based product. And quite honestly, we're still working out the details of how to join the numerator data with those reports. CQR itself does not have a way of digesting that external data, so we believe it will be the workflow will be to run your denominator report in CQR and do the numerator reporting out of FollowMyHealth through their dashboard functionality, and then to join the two reports to make sense out of them for attestation.
All right, wonderful. That's all of the questions that we have at this point. So Jessica, are there any other points of discussion that you wanted to hit?
No, that's it, really. We just wanted to make sure we talked specifically about patient engagement, some of the things to keep in mind, as well as then just showing the integration between Centricity and FollowMyHealth. If there are any other questions that come up after the webinar, feel free to reach out to me directly, and I'd be glad to get the answers for you. It's jessica.long, L-O-N-G, at jardogs, JARDOGS.com, and we will follow up with you and get those answers to you. So we thank Dr. Bassel for jumping on today and taking us through the environment, showing us a little bit more about it, and appreciate your time for joining today. Thank you.
Thanks, everybody.